Listeriosis, it is also called as silage disease or suckling disease. So this is one of the important bacterial infection, intracellular pathogen called Listeria monocytogenes. It affects most of the species in the animal kingdom. Say about 44 species of mammals, 22 species of birds and other fish crustaceans, they have isolated Listeria. So it is diverse in nature. Throughout the world, it occurs either in sporadic form here and there, or it occurs in sometimes as epidemic form. So most of the times it occurs subclinical, which we may not be aware. And when it becomes severe and it presents itself with abortions and encephalitis, then it becomes a major issue and economically important it becomes. Apart from that, in causing as a pathogen of sheep and goat, it is zoonotic, wherein it causes disease in human beings, and it is one of the most important foodborne pathogen. So in the human beings, it causes heavy case fatality, something around 20 to 30%. Murray, Webb, and Swan, they have discovered this bacteria, and this organism is, that time they named it as bacteria monocytogenes. And later in 1940, in honor of Joseph Lister, it was named as Listeria monocytogenes. And in 1980s, its role as foodborne pathogen was established. And in India, the organism was first isolated in 1950 by Viswanathan and Iyer from an infected sheep in India. And Listeric abortion was documented in 1959 in India. This also has around 17 species, but only 2 species are pathogenic, which is monocytogenes, that is Listeria monocytogenes and Listeria ivanovi. So these 2 organisms, monocytogenes is most pathogenic in human beings and also in animals, and ivanovi, it is especially to ruminants. Occasionally it causes in human beings also. So it has 13 serotypes, and these are all important when we analyze its genetic background in epidemiological answering, where from the organism originated, where it is going. So to trace back the etiology and epidemiology, these things are important. And it has 4 lineages, 1, 2, 3, and 4. And lineage 1 and 2 are important, wherein it contains the most infective serotypes, 1 bar 2b and 4b. And lineage 2 contains 1 bar 2a. And 1 bar 2a, 2b, and 4b are commonly reported in humans, whereas 1 bar 2a and 4b in animals. And this is the list of Listeria species. And if you see about that organism, it is ubiquitous. Means it is present everywhere in the world. And wherever we go, we can find this organism. And it has flagella also for its movement. And it cannot form spore, or it is non-capsulated. And it is facultatively anaerobe. And it is rod-shaped organism. And it has the ability to switch from environmental saprophyte to a potentially pathogen. And because of its facultative intracellular nature, it can be grown outside in vitro in culture plates also. When it is going inside the animal, it goes inside the cell and it proliferates. It contains many virulence factors for attaching, binding to the cells where it is targeting and getting inside the cells. It can invade both phagocytic and non-phagocytic cells. Phagocytic cells, macrophages, the mediation is by phagocytosis, while in non-phagocytic cells, entry is through the invasive proteins produced by the Listeria. And these characteristics are very important in its infection. Say, for example, it can survive at varying temperature starting from 4 degrees to 37 degrees centigrade. Of course, it is optimum at 30 to 37, whereas it can multiply at 4 degrees centigrade also. So this makes it important in growing inside the refrigerator also. So that means in case of refrigeration of food, when we are making frozen food and all, this becomes a major problem in frozen food. So it can grow at a pH from 4.5 because it needs to get inside the cell, face the lysosomes, so it can grow from pH 4.5 to 9.6. That environment, acidic environment survivability is made by its glutamate decarboxylase and arginine deaminase systems. And another important property is it is able to form biofilms, which is again important in terms of its protection within the cells of the body and not amenable to the antibiotic treatments. So it will hide within the biofilms, and because of that, treatment becomes difficult. So pasteurization temperature is of course effective against Listeria, whereas if it is inside macrophages and other things, then there might be a possibility of missing out. And if you see in India, of course, our Barbades sir also nicely highlighted the importance of listeriosis in India. So many workers have worked on Listeria in various products, various like goat milk, sheep meat, and other animals. So this is a snapshot of that. And when we come to the sources of the infection, as I already told you, it is ubiquitous in nature. It is found in soil, food sources, everywhere. One of the main source by which it enters the animals is through poorly fermented silage. So nowadays, many people are following the silage and for feeding the animals, wherein if the silage fermentation is poor, then it is one of the main cause for multiplying the Listeria bacteria, and thereby animals eating this will get the disease. In case of humans, apart from dairy foods, animal foods, even vegetables also can cause listeriosis in human beings. And one of the major source for human listeriosis is ready-to-eat foods. As I already told you, ready-to-eat foods which are stored in refrigeration, it doesn't kill the bacteria, rather it encourages it to grow, and it causes disease in the human beings. So when we see about its transmission, it can be brought by the virulent strains from the flock, from through a carrier animal, newly purchased animals, or through birds, or through rodents. So it can come through various routes. When we see the persistence of the organism, infective organism, in the sea feces, it can remain at least for 3 months. And if the soil is damp, it can remain for 1 year. And in dry soils and all, it can remain even for 2 years. So it can remain up to 2 years in the environment, thereby causing a potential infection. Risk factors, again, the poorly fermented silage, because that silage, it will have packets of aerobic deterioration wherein these organisms can grow. And if the silage is contaminated with soil, then again the possibility of Listeria getting contaminated with the silage is more. For detecting the contamination of silage with the soil, if you estimate the ash content of the silage, dry matter content more than 70 milligram per kg indicates the soil contamination. And other factors, host factors, it is mainly important that immunity of the animals should be high. If immunocompromised animals are present in the herd, then they are the first targets for these kind of organisms. And also the stress during the late pregnancy and during parturition, and when the animals are transported like pasture land, other things, this also can have entry into the animals. And long periods of flooding and natural calamities, then resulting in poor access to the pastures and other things. So these are all some of the factors which influence the Listeria infection in the animals. And with respect to the incubation period for the animals, this causes 3 different kinds of disease forms in sheep and goats that we will see one by one. So in case of encephalitis, it requires at least a month, 3 to 4 weeks for exhibiting the symptoms. Even it can go up to 2 months, at least for 7 weeks. Whereas septicemia, it is very immediate. It causes in 1 to 2 days the death. Abortions, of course, it takes around 1 week post-exposure. Among the three forms, encephalitis takes much time and septicemia is immediate. And when the encephalitic form of the disease, how it occurs is even by the infection in the tooth canal or broken teeth. So it can, organism can enter through that into the trigeminal nerve, causing the encephalitis form. Otherwise, the organism gets ingested and through the intestine, it causes further infection. In case of human beings, the incubation period varies depending upon the form of listeriosis it exhibits in the human beings, and it also varies between a day to 3 months. Inside the host, it travels cell to cell. It won't come out of the cell and reinfect the other cell. If you see the diagram, you can see that it goes with the propulsion of the actin. Like a racket, it enters into the next cell and it enters the next cell and infects. So no need of coming out of the cell. So this phenomena helps them in crossing the potential placental barrier as well as blood-brain barrier. So that is why it causes encephalitis as well as the abortion in animals. Clinical signs, one is encephalitic form, second form is abortive form, the third one is septicemic form. Apart from that, some other way also it exhibits as clinical signs. This encephalitic form is the brainstem and cranial nerve dysfunction. In the abortive form, it causes placentitis in the last period of pregnancy. This is helpful to some extent in differentiating the other microorganisms in causing the abortion, but not to the fullest extent. Septicemic form, it usually occurs in the young lambs under 5 weeks of age. It develops the septicemic form. And one more point is that the possibilities for occurrence of different forms together in the same flock is very, very rare. Say, for example, if encephalitic form of listeriosis is encountered in particular form, then the abortive form may not get expressed there, and vice versa. It can affect a single animal in a herd also. As a sporadic form, it can come, or few animals, one by one animal over few weeks also. The most serious outbreaks, if it occurs in a epidemic form, then the attack rate will be very high, reaching about 35% and more, and it can go up to 2 months period. And in this serious outbreaks, the case fatality is very high. First, when we see the clinical signs in case of encephalitis, as we already discussed that it is also called a circling disease. So in start of the disease, it exhibits fever, usually 40 to 42 degree in the early stages of the disease before it expresses other symptoms. As soon as it expresses the other clinical symptoms, the temperature usually subsides to a normal temperature. This encephalitis, it is characterized by brainstem and cranial nerve dysfunction. Thereby, it causes various signs in various animals. Signs shown by the animal will not be comparable with other, although commonly some of the signs might be present, but there are possibilities that differences in exhibition of signs between the animals in the same flock is possible. And the main symptoms are incoordination, head deviation or tilting of the head towards one side, and they start walking in circles, and they need they will press their head against some solid object, if it is wall or if we are examining towards us, so it will press its head towards support. So the main important point is it causes unilateral facial paralysis, which can be one of the differentiating factor between common encephalitis and the encephalitis caused by listeriosis. It causes only unilateral facial paralysis. So because of that one, it causes drooling of saliva. You can see from the photographs. Drooling of saliva, drooping of eyelid and the ear, as well as tongue also. Death will occur in 2 to 3 days because of the respiratory failure. Apart from that facial nerve paralysis, it expresses other symptoms also, like if you examine the eye, it shows the congestion in the scleral area. It shows that venations, as well as it causes corneal ulcers and unilateral keratitis, and these symptoms also vary between the individual animals. When we look at the abortive form, it commonly occurs as an outbreak form, and almost the outbreak abortion rate will be around crosses 10%. This abortion starts from 12th week of the pregnancy, and mostly it is noticed in the terminal period. If the infection is later part of the pregnancy, towards about to deliver, during that time, if the animal gets infected, then the possibility for stillbirth is there. If earlier part, then it is abortion will occur. And the young ones also, it can develop the fatal septicemia. So maternal metritis is one of the constant phenomena in case of listeriosis, and this retained fatal listerial septicemia may follow with regard to the fetus. Whereas if you compare brucellosis and all, the possibilities for metritis and all are very minimal. Whereas here, maternal metritis is observed. When you come to the septicemia form, it occurs in periparturient as well as the neonatal sheep and goats, as we already discussed. It occurs in very young lambs. It occurs very less commonly when we compare the abortive form as well as the encephalitis form. And gastroenteritis in the weaned sheep also occur. Along with this encephalitis form, spinal myelitis also occur, wherein it causes ataxia and knuckling of the hind limbs, progressing to the hind limb weakness, thereby paralysis also. This spinal myelitis will occur in the affected flocks, and it affects all ages. We can expect around 2% of the animals being affected with spinal myelitis in the Listeria infected herds. And also ophthalmitis and uveitis can also occur as the outbreak. And one more sign by which Listeria expresses is mastitis. Of course, it is a rare phenomena, but it also expresses, and mostly it occurs in the single quarter only, and most probably it will not respond to the antibiotics. In case of humans, mortality is 20 to 30%. It is very much high. It is caused by 13 serotypes, whereas particularly it is 2A, 2B, and 4B. Between the forms as well as the infection, if we see, perinatal listeriosis very well go along with the serovars 1/2B, 3B, and 4B. And in case of human beings, one more most important thing is that it affects mainly the cancer patients. That means immunocompromised people, cancer patients, HIV patients, and also pregnant women, elders, and children. They are most susceptible for this Listeria in normal human beings as well as in normal sheep and goats. Listeria can be ingested. Listeria can be found in healthy animals, healthy human beings, feces. It does not indicate the infection unless or otherwise it invades inside and causes the disease. Till then, we cannot term it as a disease. In case of human beings, like we have seen in sheep and goats, and the signs include from normal symptoms like gastrointestinal symptoms. Starting from that, it can cause severe symptoms like meningitis and encephalitis. The major symptoms will be towards meningitis and encephalitis also. Most commonly in 60% of the cases, meningitis will be present. Apart from meningitis, other minor things like headache, nausea, pneumonia, and conjunctivitis also will occur. And in case of acute infections, disease onset will be very quick, and within 2 days it can cause death. In case of risk group, risk population, those who are dealing with chicken farms and all, wherein Listeria, if it is present, it can cause conjunctivitis in the poultry workers. And in case of veterinarians handling dystocia, and if the animals are having infected with Listeria, then a dermatitis with rashes occur in the arms of the veterinarian, similar to that of allergic rashes. Quantity of the bacteria that is consumed inside also matters in causing the disease. If the level is beyond 100 CFUs, that is 100 colony forming units, then the possibility of occurrence of the disease is there. And if the number is very great, then immediately it causes fatal disease. So when we come to the lesions exhibited by the animals because of the infections of the Listeria, in aborted fetus, there is no gross lesions. Appreciable gross lesions will not be there. Autolysis might be there if the animal, if the fetus is not expelled, and it may cause autolysis. Aborted fetus can have small yellow foci of necrosis in the liver. It can also have some shallow abomasal erosions. The postmortem findings and histopathology is mainly based upon the form which it exhibited. Say, for example, encephalitis form will have brain pons and other related symptoms, whereas abortive patient form will show the symptoms or lesions with the reproductive system and so on. In case of encephalitic form, CSF is cloudy and there will be congestion of the meningeal vessels. In the CSF, we can find various cells, monocytes will be more, and there will be no gross pathological lesions in the brain. Only discoloration of the brain stem will be there with the softening and association of medulla sometimes. Even when we are doing postmortem, only seeing the forebrain, we may come to a conclusion brain is perfectly all right. But if you see the brain stem only, then we can understand the things. And this histopathology is of pathognomonic importance, which is of having micro abscesses in the brain stem, spinal myelitis. So this is the very important confirming sign for the Listeria. Apart, in addition, perivascular lymphocytic coughing, vasculitis, edema, and hemorrhages. So most commonly, involvement of the medulla and pons will be there. And in the septicemic form, necrosis in the liver and spleen might be seen, but not very frequently. So in case of differential diagnosis with respect to the encephalitis, then we have to differentiate with respect to pregnancy toxemia, rabies, git, polioencephalomalacia, medullary disease, scrapie. One of the most important differentiating factor to some extent is its unilateral facial paralysis with the deviation of head and neck to one side. And in case of polioencephalomalacia, it won't cause convulsions, and as in case of pregnancy toxemia, it won't cause spasmodic rotations or deviations. So these are some of the differentiating factors wherein we can confine towards the Listeria. In case of abortions, of course, very difficult to say that it is of Listerial abortion just by counting the number of months and by seeing the placenta and the aborted fetus. It requires further laboratory investigations to say, because in sheep and goats, there are other abortifacient microbes such as Brucella. Brucella is one of the dominant microbe in causing sheep and goat abortions. It causes the most percentage of abortions in sheep and goats in terms of bacterial caused abortions. And other than that, chlamydia, coxiella, and other abortions, which requires some sort of laboratory interventions to look at it so that we can come to a conclusion what is the reason for that abortion. In case of Campylobacter, of course, it can occur in early part of the life, I mean pregnancy, and in case of Toxoplasma, it can occur at any stage of the pregnancy. Diagnosis, if you see, it is based upon the history, clinical signs, and the pathological lesions, and finally by the detection of the pathogen. When we see the previous exposure, whether it is their herd is previously exposed to Listeria earlier, their feeding habits, whether there is silage feeding, their grazing pastures, and those things will help in arriving at the presumptive diagnosis. Definitive diagnosis, if you want to make, it is possible only after the isolation and identification of the bacteria, or at least by the PCR and other related diagnostic tests. Human listeriosis, it is clinically confirmed when organism is isolated from the blood, CSF, or otherwise a sterile site, because fecal and other material may contain Listeria. It doesn't say that the infection is due to Listeria unless or otherwise we have a confirmation with other tests. The diagnosis, it can have antigen detection test or antibody detection test, or the golden standard test, which is isolation. So in case of antigen detection test, the regular PCR, the LAMP, which is called loop mediated isothermal amplification, which can be performed at the field level also. It is easy to perform, quick to perform. Only drawback with that is sometimes contamination may occur and very difficult to remove that contamination. Even the negative sample also, it can give us a positive. That is one of the drawback of the LAMP. Whereas otherwise, it is a very quick test to say the result, as well as it is quick and we can do at farm level also. Real-time PCR is very much helpful in case of not only detecting that it is due to Listeria, but also it can detect the load of the bacteria. So load of the bacteria is also important in case of swabs, as well as in case of food materials when we are analyzing what is the load present in per gram of the sample what we have taken. So that way real-time PCR helps in quantifying the amount of organisms present at the initial point of time. Apart from that, immunohistochemistry and immunofluorescent assays for advanced techniques such as PFGA, other sequencing, those things are useful when we go for tracing back where from it originated and other kind of things. Of course, there are many serodiagnostic assays in Listeria, whereas in animals, it may be of little help, because by serology, we cannot confirm the disease, because most of the animals may got exposed to the organisms that it might be having antibodies. It doesn't mean that animals are having infection at that point of time, or animals are suffering from the disease. Combined use of ELISA and PCR can, to some extent, in absence of the isolation, can help in arriving the diagnosis. So the samples preferred for isolations are the liver, brain, heart, fetus, placenta, milk, blood, CSF, aquilar swabs, feed samples. Again, it depends upon which form it exhibited, and based upon that form, the whatever the samples related to that, we need to collect. So in case of isolation, there are various media available, and by utilizing those media, these are chromogenic media. You can see here black color, which indicates because of the spleen release, because the lithium chloride is added to the medium, it causes black color. It indicates that the organism is Listeria. After identifying the Listeria, we can go for species, which species, that we can go by sequencing species identification by PCR also. So this way we have identified, this is one from fishes, which is showing it as this is in aqua. So that way we can identify. In case of laboratory animals, of course, this is not practiced widely. It is called anten test, wherein the infected materials is dropped in the conjunctiva. It causes the conjunctivitis or keratoconjunctivitis in 24 to 36 hours. And other tests like immunohistochemical testing, wherein we can locate the antigen in the lesions, by immunohistochemical testing. So these are some of the tests, and this is PCR. So when we see, this is the OAE recommendation. When we do the test, then there should be a purpose for the test. So if we use the PCR methods, when we declare a population is free from infection, the herd is free from infection, then PCR method can be a good technique. Chromogenic isolation, as I have already shown you, that is also a good technique. So when we see that, only the isolation as well as PCR are good techniques over the various purposes, whether to declare freedom from infection or individual animal freedom from disease prior to the movement or confirmation of clinical case, whatever it is, these two. And when we look at the serology, it is almost not useful, or it is useful to limited extent. So again, prevention and control, since it is ubiquitously present in the environment, very difficult to control the organism. And the best way is to avoid the contamination of the feces, keep the sheds neat, contaminating materials, beddings, litters, those needs to be removed properly, to be taken care, proper hygiene to be maintained in the farm. So these are the general biosecurity measures sheep or goat farm needs to follow, so that this can make rid of this Listeria monocytogenes also. So in case of handling abortive things, then we have to be very much careful, not only for Listeria, for any abortion causing agent. We need to be careful. We need to use the protective clothing, mask, and other things, so that zoonotic transmission can be curtailed. And also in case of cattle, routine testing of raw milk, and in case of here also goat milk and other things can be tested. So vaccines, of course, it is not needed, no reason for vaccination, but sometimes it might be needed for tackling the infection in sheep and goats if it occurs in epidemic form and other things. But as of now, we don't have any standard vaccine for this. It is in the process of development. So when we come to the treatment, of course, the treatment, individual treatment may be successful, may not be successful. It depends upon the time period when we start the treatment. In case of encephalitis and all, there are reports by which we can recover the animal, and many times we will lose the animal also. Whereas in abortions and other complications, we don't lose the animal. In septicemia, death occurs. In abortions, death won't occur, but we lose the young ones. So mainly, if the farm is suffering from Listeria, then as a prophylactic measure for other animals which are susceptible, we can try with sulfonamides, penicillin, and tetracycline. And for treatment purpose, we can treat with chlortetracycline for 5 days, penicillin for 7 days, and based upon the status, fluid therapy and other things can be given. Even to reduce the inflammation of the brain, DEXA can be given even if the animal is pregnant, because we may not know the pregnancy will be maintained or not. So to save the animal, we can give the DEXA also, dexamethasone. And for human beings, the drug of choice is erythromycin and ampicillin. Again, based upon the symptoms, the other medicines will be administered. And the Listeria isolates have resistance for gentamicin, cotrimoxazole, and aflatoxin. So many Listeria express various antimicrobial resistance, and the studies are going.